It often begins quietly, almost unnoticeably. An extra few strands of hair caught in your brush, a slightly wider parting seen in the unforgiving light of the bathroom mirror, a subtle thinning at the temples. We dismiss it at first. Stress, a new shampoo, the change of seasons. But when the shedding persists, becoming a soft, constant rain of what was once our crowning glory, a quiet panic begins to set in. We search for answers in bottles of biotin and thickening tonics, rarely suspecting that the true culprit might be a small, butterfly-shaped gland nestled silently at the base of our neck. This is the story of the thyroid gland, the body's unsung metabolic conductor, and how its delicate hormonal symphony, when disrupted, can have a profound and distressing impact on the health and vitality of our hair. The connection isn't merely coincidental. It is a deep biological entanglement where the life cycle of every single hair follicle is directly tethered to the proper functioning of this powerful gland. Understanding this link is the first step toward reclaiming not just your hair, but your overall well-being. The thyroid gland, for all its immense power, is deceptively simple in its primary mission. It governs the body's metabolism. Think of it as the engine's throttle. It produces and releases two principal hormones into the bloodstream, thyroxine, known as T4, and triiodothyronine, known as T3. While T4 is produced in much larger quantities, T3 is the more biologically active form, the one that truly presses the accelerator on cellular activity. Most of the T3 circulating in our body is actually converted from T4 in peripheral tissues like the liver and kidneys. These hormones travel to nearly every cell in the body, instructing them on how quickly to use energy and perform their designated functions. This intricate system is itself regulated by a higher command structure known as the hypothalamic pituitary thyroid (HPT) axis. The hypothalamus in the brain releases thyrotropin-releasing hormone, TRH, which signals the pituitary gland, also in the brain, to release thyroid-stimulating hormone. TSH then travels to the thyroid gland and, as its name suggests, stimulates it to produce and release T4 and T3. When there are enough thyroid hormones in the blood, a negative feedback loop tells the pituitary and hypothalamus to slow down, maintaining a state of perfect equilibrium, or homeostasis. It is a system of breathtaking elegance, and it is this very system that directly dictates the health of our hair. To understand why a metabolic issue translates to hair loss, we must first appreciate the hair follicle itself. It is not simply a dead strand of protein, it is a complex, dynamic, and incredibly energy-intensive miniature organ. Each of the roughly 100,000 follicles on the average human scalp cycles through distinct phases. The most important of these is the anagen, or growth phase. During this period, which can last anywhere from 2 to 7 years, cells in the follicle's root are dividing rapidly, pushing the hair shaft upward and outward. This is a period of intense metabolic activity, demanding a constant and robust supply of energy and nutrients. Following anagen is the catagen phase, a brief transitional period lasting a few weeks where the hair follicle shrinks and detaches from its blood supply. Finally, the follicle enters the telogen, or resting phase. For about 3 months, the hair shaft sits dormant in the follicle before it is eventually shed during the exogen phase to make way for a new anagen hair. At any given time, about 85 to 90% of your scalp hair should be actively growing in the anagen phase. Thyroid hormones are critical regulators of this cycle. T3 and T4 act directly on the stem cells within the hair follicle bulge and on the dermal papilla cells at the base of the follicle, which are the command center for hair growth. These hormones help initiate and, crucially, maintain the anagen phase. They essentially provide the go signal for the follicle's cellular machinery, ensuring it has the metabolic support to sustain its rapid division and growth. When thyroid hormone levels are optimal, the anagen phase is long and robust, resulting in thick, healthy hair. When these levels fall out of balance, this meticulously choreographed cycle is thrown into disarray. The hormonal signal is either too weak or erratically strong, directly impacting the follicle's ability to function. The result is a disruption that manifests as noticeable hair loss. This brings us to the two primary forms of thyroid dysfunction, hypothyroidism and hyperthyroidism. Hypothyroidism, or an underactive thyroid, is the more common of the two conditions. It occurs when the thyroid gland does not produce enough T4 and T3 to meet the body's needs. The entire metabolism slows down to a crawl. In this state of hormonal deficiency, hair follicles receive an insufficient signal to grow. The primary mechanism of hair loss in hypothyroidism is a condition known as telogen effluvium. The lack of adequate T3 and T4 prematurely shortens the anagen growth phase, forcing a much larger than normal percentage of hair follicles to shift into the telogen resting phase all at once. Instead of the typical 10 to 15% of hairs being in the resting state, this number can jump to 30% or more. After the 3-month resting period, all of these hairs are shed simultaneously, leading to a sudden and often alarming increase in hair fall. The hair loss associated with hypothyroidism is typically diffuse, meaning it affects the entire scalp rather than creating distinct bald patches. The hair that remains often changes in texture, becoming dry, brittle, coarse, and dull. It lacks luster and is prone to breakage. This change in texture is because thyroid hormones also influence sebum production, and with low levels, the scalp becomes drier. In some cases, a classic sign of hypothyroidism is the loss of the outer third of the eyebrows, a condition known as matarosis or Queen Anne sign. Body hair, including pubic and axillary hair, may also become sparse. This hair loss is, of course, accompanied by a host of other systemic symptoms reflecting the body's metabolic slowdown: profound fatigue, unexplained weight gain, intolerance to cold, dry and pale skin, constipation, muscle aches, depression, and cognitive issues often described as brain fog. On the other end of the spectrum is hyperthyroidism, or an overactive thyroid. Here, the gland produces an excess of T4 and T3, sending the body's metabolism into overdrive. It might seem counterintuitive that both too little and too much of a hormone could cause the same problem, but in the finely tuned world of biology, any deviation from the norm can be disruptive. In hyperthyroidism, the accelerated metabolic rate also prematurely shortens the anagen phase. The hair growth cycle is sped up to an unhealthy degree, rushing hairs through their growth phase and into the telogen phase far too quickly. This again results in a diffuse telogen effluvium, with increased shedding all over the scalp. However, the character of the hair and the accompanying symptoms are starkly different. While hypothyroidism causes coarse, dry hair, the hair in hyperthyroidism is often described as being extremely fine, soft, and silky, but also weak and prone to breaking. It may appear thin and fly away. The clinical picture of hyperthyroidism is one of a body running on high alert. Anxiety, irritability, unexplained weight loss despite an increased appetite, heat intolerance, heart palpitations or a rapid pulse, hand tremors, and sometimes a visible swelling in the neck known as a goiter. The hair loss is just one piece of a much larger puzzle of systemic overstimulation. The story becomes even more complex when we introduce the concept of autoimmunity. The vast majority of thyroid disorders in the developed world are not caused by simple gland failure or nutritional deficiency, but by the immune system mistakenly attacking the body's own tissues. The most common cause of hypothyroidism is Hashimoto's thyroiditis. In this condition, the immune system produces antibodies, primarily thyroid peroxidase (TPO) antibodies and thyroglobulin (TG) antibodies, which target and gradually destroy thyroid tissue. This leads to a progressive decline in the gland's ability to produce hormones. Conversely, the most common cause of hyperthyroidism is Graves' disease. In this autoimmune disorder, the body produces a different kind of antibody called thyroid-stimulating immunoglobulin, TSI. These antibodies mimic the action of TSH, binding to the TSH receptors on the thyroid gland and relentlessly stimulating it to overproduce T4 and T3, irrespective of the body's actual needs. The presence of an autoimmune thyroid condition can sometimes be associated with other autoimmune forms of hair loss, such as alopecia areata, which causes distinct round patches of hair loss. This overlap underscores the importance of a thorough diagnosis, as the pattern of hair loss might not be purely the diffuse thinning of telogen effluvium. Given the vague and overlapping nature of many symptoms, a definitive diagnosis cannot be made on clinical presentation alone. It relies on specific blood tests that measure the key components of the HPT axis. The first and most sensitive test is for TSH. In primary hypothyroidism, where the problem is the thyroid gland itself, the pituitary gland works overtime trying to stimulate a failing thyroid, resulting in a high TSH level. Conversely, in primary hyperthyroidism, the excess T4 and T3 in the blood tells the pituitary to shut down, resulting in a very low, often undetectable TSH level. While TSH is a good screening tool, a comprehensive diagnosis requires a full thyroid panel. This includes measuring free T4 and free T3. Free refers to the portion of the hormone that is not bound to proteins in the blood and is therefore biologically active and available for the cells to use. In hypothyroidism, free T4 and sometimes free T3 will be low. In hyperthyroidism, they will be high. Finally, testing for thyroid antibodies, TPOA, TGA for Hashimoto's, and TSI for Graves' is crucial to determine if the underlying cause is autoimmune. This information is vital for long-term management and understanding the nature of the disease. A proper diagnosis is the bedrock upon which successful treatment is built. Treatment for thyroid disorders aims to restore normal hormone levels, a state known as euthyroidism. For hypothyroidism, the treatment is lifelong hormone replacement therapy. The gold standard is a synthetic T4 medication called levothyroxine. The body absorbs this T4 and converts it into the active T3 as needed, closely mimicking the body's natural process. Finding the correct dose is a careful process of titration, starting with a low dose and gradually increasing it based on follow-up blood tests, primarily TSH and free T4, every 6 to 8 weeks until a stable, optimal level is reached. Once stabilized, monitoring is typically done every 6 to 12 months. For hyperthyroidism, treatment is more complex and focuses on reducing the production or effect of thyroid hormones. There are 3 main approaches. Antithyroid drugs, such as methimazole, work by blocking the thyroid's ability to use iodine to produce hormones. Radioactive iodine, RAI therapy, involves swallowing a capsule of radioactive iodine, which is taken up by the thyroid cells, destroying them, and thereby reducing or eliminating hormone production. This usually results in permanent hypothyroidism, which is then managed with levothyroxine. The third option is a thyroidectomy, the surgical removal of all or part of the thyroid gland, which also results in permanent hypothyroidism requiring hormone replacement. The choice of treatment depends on the patient's age, the severity of the condition, and other individual health factors. Once treatment is initiated and hormone levels begin to normalize, many people anxiously await the return of their hair. It is essential to have realistic expectations about the timeline for hair recovery. The first thing that happens is that the excessive shedding stops. However, this may not occur for several months after achieving euthyroidism. The hair follicles that were prematurely pushed into the telogen phase must complete their 3-month resting cycle before they are shed. Therefore, it can take a full 3 to 6 months after hormone levels have stabilized for the hair fall to return to a normal rate of 50 to 100 hairs per day. Actual regrowth is an even slower process. The new anagen hairs grow at an average rate of about ½ an inch per month. It will take many months, often 6 to 12 or even longer, before a noticeable improvement in hair density and volume is apparent. This period requires immense patience. It's a marathon, not a sprint. The new hair may initially have a different texture, but it typically returns to its normal state over time. While medication is the cornerstone of treatment, nutritional and lifestyle factors play a significant supportive role in both thyroid health and hair recovery. Certain micronutrients are indispensable for thyroid function and hair growth. Iodine is a fundamental building block of thyroid hormones, but balance is key. Both deficiency and excess can cause problems, especially for those with Hashimoto's, where high iodine intake can sometimes trigger a flare-up. Selenium is another critical mineral, acting as a powerful antioxidant in the thyroid gland and, importantly, facilitating the conversion of inactive T4 to active T3. Zinc also plays a role in this conversion process. Perhaps one of the most crucial cofactors for hair health is iron. Iron deficiency, specifically low levels of stored iron measured as ferritin, is a very common cause of hair loss in its own right and frequently coexists with thyroid disorders. Low ferritin can cause diffuse hair shedding that mimics or exacerbates thyroid-related hair loss. Many endocrinologists and dermatologists will not consider hair loss fully addressed until ferritin levels are optimized, often aiming for a level above 50 or even 70 nanograms per mil. Other vital nutrients include vitamin D, which has a role in immune modulation, and B vitamins, particularly B12, which is often low in people with autoimmune thyroid disease. A nutrient-dense whole foods diet is paramount. Lifestyle adjustments are also beneficial. Chronic stress is a significant factor, as the stress hormone cortisol can interfere with the HPT axis and T4 to T3 conversion and can independently trigger telogen effluvium. Incorporating stress management techniques like yoga, meditation, or deep breathing can be incredibly helpful. Gentle hair care is also wise during the recovery period. Avoiding harsh chemical treatments, excessive heat styling, and tight hairstyles that put physical stress on the follicles can prevent further breakage and loss. We cannot discuss hair loss without acknowledging its profound psychological impact. For many, hair is deeply intertwined with their sense of identity, attractiveness, and self-confidence. Losing it can feel like losing a part of oneself. It can lead to significant distress, social anxiety, and even depression. The fact that the cause is an invisible illness can be particularly frustrating. Friends and family may not understand the depth of the emotional pain associated with the physical symptom. It is vital to validate these feelings. The distress is real and significant. Seeking support, whether from a therapist, a trusted friend, or a patient support group, can be just as important as medical treatment. Addressing the emotional toll is a critical part of the healing process. Navigating the complexities of thyroid disorders and their effect on hair requires a partnership between the patient and their healthcare team. While a primary care physician can initiate diagnosis and treatment, consulting with a specialist, an endocrinologist, is often essential for fine-tuning treatment, especially in complex cases involving autoimmunity or difficulty in stabilizing hormone levels. For persistent hair loss, a consultation with a dermatologist can also be invaluable to rule out or identify any coexisting scalp conditions. The journey to recovery is one of empowerment through knowledge. It involves understanding your condition, adhering to treatment, advocating for comprehensive testing, nurturing your body with good nutrition, and being patient and kind to yourself through the process. The path back to health can be slow, but with the correct diagnosis and consistent, well-managed care, the hormonal symphony can be restored. And as the body finds its equilibrium, the quiet, steady process of regrowth can begin, strand by hopeful strand.